Well, nobody actually invented biomimetic dentistry. There was a whole bunch of research that was done all around the world. And the leaders in biomimetic dentistry put this information together so that people like me, practicing dentists, could have a protocol, because we don't have time to read the journals, the really high-end journals. So, we glance through them, but we can't see whether they're good studies or poorly done studies. So the leaders that I have gone to, who actually came up with the name Biomimetic, which means mimics life, are Dr. David Alleman, Dr. Simona Della Peri from Sardinia, Dr. Pascal Magna from, he's in California, he's from Switzerland originally. So these people are the leaders that created courses so the general dentist could study. So nobody invented it, it's just that all this research came together in a way that we can make teeth last many, many years without having to amputate a lot of healthy tooth structure. The restorative technique of biomimetic dentistry is different than regular dentistry, because in regular dentistry there's a little micro gap. There's a space where germs can get underneath the restoration. So silver fillings leak horribly. Crowns, the best crown in the world, done by like the best professor of the best university dental school, has a micro gap that 6 germs can fit underneath side by side. So no wonder crowns have to be replaced. They're not the permanent restoration that people think. So silver filled potholes. Now we have biomimetic dentistry, which is a takeoff on composite resins. So composite resins we learned many years ago, and we never accounted for the fact that they shrink during the first 5 minutes of placement. So you can't just put in a lump of the bonding and harden it with a light. You have to take steps to make sure that it sticks tightly to the tooth. So the gap, the micro gap underneath a biomimetically done composite resin restoration is less than 1 micron. So not even 1 germ can fit in there, because 1 germ is about 1 micron. That's why it works. Now, of course, the patient's home care, the brushing and flossing is important too, but to get underneath the restoration, it's not going to happen. In biomimetic restorations, you want to design the restoration so that the restoration would fail. So when you put in the first layer of the bonding, it sticks really tightly, and you go slowly so that sticks so tightly to the tooth that if the patient earthquakes their tooth, something might break, but that first layer will stay tight so the germs can't attack the tooth. Germs can't eat resin, they can only eat dentin and enamel, so that if germs get underneath because of your fracturing, your grinding, your occlusion, you're chomping on an olive pit, you will still have that layer staying tightly against the tooth. So I'd rather have the restoration fail than have the tooth fail and need a root canal or an extraction. Traditional bonding, as it's taught by manufacturers and in dental schools, is you place the bonding material in there. And you don't get into as much detail the characteristics of the material itself. So the bonded material itself shrinks. And if you put in a lot of material at once, and it's bonded to the sides of the tooth, then as it shrinks over the first 5 minutes, 30 minutes, 24 hours, it's going to pull the sides of the tooth together. And the tooth is going to want to stand up straight again. So it may be bonded, but how long are those bonds going to last? They are going to fatigue. Any bond will fatigue, but you want it to fatigue over 30 years, not over 6 years. Traditional bonding, the average life expectancy is about 6.2 years. Whereas in biomimetic restorations, the bonding is done so differently that the restoration is likely to last 30 years. That's basically the difference. A real toothache, it's probably too late. But sensitivity to cold, that's a warning sign. So if you get to your dentist right away, and if you can get a biomimetic restoration done, then you probably can avoid the root canal. If it's sensitive to hot, it's probably too late. Although I have tried that and I've had some success with that, but it is probably too late. I've had people call me from across the country saying, my dentist told me I needed a root canal, because on the x-ray it shows how deep the decay is. But the rule for biomimetic dentistry is no matter how deep the decay is, you can still keep the tooth alive if the patient has no symptoms. So if your dentist says you need to have root canal, and it's because it's going to need a root canal in a year anyway, we might as well do it now before we do the crown, that isn't necessarily so. As a matter of fact, it's not so in 99.9% of the cases. So I can take out the decay, and there's a little bit left, and I know if I take out that last bit of decay, I'm going to see your nerve. Biologically, I'm able to condition that tissue, leave that decay there, and by taking out all the other decay and treating it biomimically, that decay will remineralize, and you're likely not to need a root canal there for the rest of your life. Infected dentin has to be removed. It's when the bacteria have totally decomposed the dentin inside your tooth. Mm-hmm. Affected is what is ahead of the bacteria haven't invaded it, but their acids have affected it, they've damaged it. But that part can be left inside the tooth. So in biomimetic dentistry, I learned how to differentiate the infected dentin, which has to be removed, from the affected dentin, which can remineralize if you give it the proper environment, which is a biomimetic restoration. It's the fail-safe part of it. It's that you're bonding so tightly to the tooth that if you do break something, it's going to be far away from the tooth, the nerve. And if you have the whole periphery of the tooth still intact, that's a whole lot of strength. So you're maintaining the natural strength that the tooth has. That's probably a big part of it. A crown is very strong. It's made out of porcelain fused to metal. It's rigid. It has no flexibility at all. So if you put something that's that rigid onto a structure, a tooth, that's flexible, it's not going to work. Because when you chew on that tooth, the crown is going to transmit all the forces from the crown to the root of the tooth itself. So I've seen teeth crack underneath crowns. So just the concept of putting something hard around something that wants to move, common sense would tell me that that doesn't work. So if you eat food, the pH of your mouth drops to an acidic level while you're eating it and for 15 minutes afterwards. So back in the day when people ate lifesavers, you'd say if you're going to eat a lifesaver every 15 minutes, you're going to keep your mouth at a pH that's conducive to the bacterial growth for a prolonged period of time. So if you're going to eat lifesavers, eat the whole pack at once, which nobody's going to do. You're not going to do that. And if you chew it up, you're going to break your teeth. But another example is soda, because people will sometimes keep a container or a cup of soda on their desk, and they'll take a sip every few minutes. So by doing that, you're keeping the pH at an acidic level, which is really conducive to the growth of bacteria. And the bacteria produce an acid which breaks down not only the collagen in your gums, it also breaks down your tooth. So once you get your tooth demineralized or decalcified, the germs can get in deeper and really cause the infection, which we know to be a cavity. So rinsing your mouth with water is a good idea because it dilutes what's going on and it gets the pH back up to a more neutral level quicker. Air abrasion is sandblasting the tooth. So you can actually cut through enamel and dentin and take away the decay without using the drill, which means you wouldn't use Novocaine. It works out perfectly for young children because their decay generally is not deep. They're the ones that are most afraid and intolerant of anything like a needle. So it's great to clean out the grooves, and you might do that. I do that even before I do a sealant. But if I find that there's actual decay there, I will just prepare the tooth by using the air abrasion. Generally, if it's not decay, tooth sensitivity can come from two things: silver fillings, metal transfers cold to the nerve of the tooth. So if it's a deep filling, which many of us have had deep fillings, deep silver fillings, our whole mouth is sensitive to cold. We don't like to eat ice cream. So having the amalgam, the silver filling removed, is a good idea anyway, for many reasons. The other reason for tooth sensitivity can be because of nighttime grinding. So sensitivity is often from that, sometimes it's from decay, and sometimes it's from silver fillings. Well, with any instrument or tool, it's how you use it. So I try to get patients to use the manual toothbrush and the floss in a way that they'll get their teeth clean. Now, some of them love the electric toothbrush, and if they're getting the results, if there's no bleeding on probing, if their gums are tight and firm, and they're not getting new decay, I'll just say, keep doing what you're doing. It doesn't matter, just keep doing that. But if I'm finding there's an area that they're not reaching, and they really want to use the electric toothbrush, I might add a gadget that will help them in that particular area where a tooth might be rotated or leaning in or just hard to reach. So I can't say that I think one's better than the other, really. I happen to like manual. I think that it works better. Plaque is more like Vaseline. So you're trying to get a layer of slime off your tooth, and the water pick just doesn't do it. So if you put Vaseline on the window and tried to hose it off, it wouldn't work. You'd want to get a paper towel to really wipe it off. So think of plaque in the same way, that the water pick may have some value, but when people tell me they don't have enough time to take care of their teeth as much as they need to get the results of good health, and incidentally, periodontal disease, gum disease, is associated with heart disease. So if they don't have enough time, I wouldn't say choose the water pick as your second thing. I'd say brush and floss. If you have extra time and you want to use the water pick, then you can use the water pick. We sometimes use it to deliver an antibiotic underneath the gums, so the patient doesn't have to take a pill and have it into their whole body. They can just get it underneath the gums. In the long term, it's costing you a whole lot less than regular fillings and bindings, because if you have to keep having things redone and you end up needing the root canal or the crown, which at today's fees are outlandish, but if you only have to have one thing done every 20 or 30 years, you're way ahead of the game. So it actually does cost less. Up front, it costs more, it takes longer. It takes quite a bit of time, but it's worth it. You don't have to go through it again. You don't have to sit there and have discomfort and pay again and have your mouth open. You can just go about your business and not have to go. I don't see my patients as often as they see the hygienist. You know, I'll do an exam once in a while, but they're just now seeing the hygienist. Once they're done, they're finished, and I miss them. But I'm happy they don't have decay again. Biomimetic dentistry is more commonly used in adults. In children, it actually makes the children's lives quite easy. You clean out the grooves with the air abrasion, and you put on a type of sealant that allows the enamel to mature, because there's two types of sealants, and the kind that allows the enamel to mature is much better, because then the enamel gets stronger over time. But for children, it means maintaining their teeth and not having to go through extensive pediatric care. But with anything, you know, the sooner that they get examined and have the decay removed and are taught good diet and health habits, the better it is. Ask your dentist to please look into Find a Biomimetic Dentist. There's tabs on Find a Biomimetic Dentist, and they can learn how easy it is to take the course, and how if they change one thing and do that one thing biomedically from the course, their restorations will be many times better. So ask your dentist. We need more dentists doing this.